The virus is here with us to stay. SARS-CoV-2 is circulating in every country right now. We're in the fourth year of this pandemic. And the announcement yesterday was talking about the crisis phase, the emergency phase of the pandemic, of COVID-19. But COVID-19 has not gone away. What the DG said yesterday was that the emergency phase is over, but COVID is not. So that's what we are dealing with right now. We're better at managing COVID-19, but as the viewers have pointed out, people are getting infected, which is why we have to keep up our efforts to reduce transmission. We have to keep up our efforts to ensure that people who do get infected get the right clinical care so that they don't die. We have to make sure that people who are required or recommended to get additional doses of vaccine receive those, and that countries, all people everywhere, have access to antivirals. And we can't forget about the basics. You know, the wearing of a mask where appropriate when you're in a really crowded situation and you know the virus is circulating, especially if you're in a category of being at risk for developing severe disease or dying. So people who are over 60, people who have underlying conditions, immunocompromised individuals. We've said, for the last 3.5 years, it's the do it all, but it's not do it all at once. We are living with this virus. We're still learning to live with it, and we're getting better at it. But that's what we mean by being vigilant. So the threat is not gone, but it's not the same as where we were 3.5 years ago. So this step that we took yesterday, that the DG took yesterday, acknowledges that the emergency part is over, but COVID is not. So the message to think that this is all over is not the message we want to convey. However, we do recognize that individuals that are out there are living their lives. They're living their lives as safely as possible, and they're going about their business. We need governments to not drop the ball and make sure that governments retain the systems in place for surveillance, for clinical care, for genetic sequencing, for infection prevention and control, all of the elements of community protection, risk communication, and community engagement, infodemic management, all of the different activities governments need to focus on, so that they can monitor the changes and scale up and scale down as necessary.